Now, I know people have a lot of questions about healthcare. Anybody here wondering what's going to happen in the next 4 years with our healthcare system?
That would be great to know, Gary.
The one thing I'm seeing as far as our healthcare system, we pretty much know who's going into office come January 20th. Right? That's already out there. The concern I have is when we look at our healthcare system moving forward, with this current pandemic that we're in now, it's putting financial stress not only in the healthcare system, but also on the insurance company. And we're not talking about a couple million or a couple $1 billion. This is going to be very, very costly to all of us, particularly using the healthcare system. Well, the government's got to address this, right? Because the companies, the insurance companies, and the healthcare providers that are providing this, they're going to have to be paid. So what's going to end up happening most likely is I can see us going to what they call a single payer healthcare system, similar to what we see in Canada or in the UK. Now, some people will say, well, there's nothing wrong with that. Well, it depends on who's paying for your care and whether or not you're going to get approved for a particular procedure. One thing I see with our healthcare system, because something has to be done, the premiums every year are going up. So if you looked at your premiums, what you paid for in 2020 versus what you're paying in going in 2021, one thing that's all in common, it's going up. It's whether or not you're getting a subsidy to offset that cost. And for employers, that's a whole new step. One of the things that Mike alluded to earlier about Starbucks, their biggest expense isn't the coffee, it's their health care. And guess what? If you're an employee in a company and you're over the age of 50, what do you think the cost of your company's health care is for you? It's getting higher. So when people are getting laid off and they're over the age of 55, and is there discrimination there? uh, you kind of wonder, right? Because the cost of healthcare for older folks over the age of 60 is much higher than it is for somebody that's 25. That's why it's more difficult as people get older trying to get a job. Right? And if you can't afford your health insurance, hey, listen, there's called Medicare or Medi-Cal. Medi-Cal is in the state of California, and Medicaid's on a federal level. You won't be without health insurance. So if you end up in the hospital, Medi-Cal will pay your bill. But the challenge here is generally if you're in the hospital and you have to follow up, you have to follow up with a doctor. Good luck finding a doctor. Now that everybody's required to have health insurance, good luck trying to find a doctor. It's people. I'm hearing conversations from people. It's taken them 6 months to see their doctor. Well, that's not going to get better. It's going to continue to get worse. So what ended up happening if we go to a single payer healthcare system, which is going to be run by the government, similar to Medicare for all, well, if you're expecting to get a procedure done, well, you could wait 6 months to a year to have that done. So what some people are doing in other countries, specifically Canada or UK, if you want to get better care, what are you doing? You buy health insurance from a private health insurance company. Now, the problem with that is we'll go back to what we had prior to 2013, where private insurance companies will have what they call underwriting, which will determine your eligibility to be able to buy private health insurance. And if you can't qualify because you have a pre-existing health condition, or you're taking some medication that's not approved, that you're going to get declined for health insurance, they'll simply tell you you'll have to stay on the government-run program. So the one thing is I'm trying to help people understand this is a wake-up call. The days of just taking health for granted, those days are over. It comes down to you as an individual to take personal financial responsibility for your own health, because nobody else will. I'm telling you what, the hospitals and doctors, they're going to treat you, but are you going to be walking out with a bill? So if you want to understand how supplemental insurance protects you, then we need to have a conversation. So Stacey, that kind of help you a little bit?
Yes, great. Thank you.